Hello, everyone, and welcome to a new session with Rights and Responsibilities Awareness Initiative. Today, we are with Ernest Johansson, mental health expert, to talk to us about youth pressure, risks, and mental health issues. Very important, sensitive topic. So, Ernest, thank you so much for being here today with us to talk about this important topic.
Thank you very much for having me. These topics are near and dear to my heart and quite important, and I'm very appreciative of the opportunity to talk about them. So today's topic is kind of youth of today vis-a-vis mental health. And there's a few things I wanted to point out. And I think one of the intellectual traps that an individual or a collection of individuals or any discussion can fall into is a romanticization, I can't talk today, a romanticizing of the past that imagines a historical status quo as somehow inherently better and idealized. And this phenomenon is called the status quo antebellum or status quo antebellum, that it is idealized to the point where perils of the time or risks of the time are very minimized. And it's an intellectual trap because I think it stunts honesty in conversation. And I think especially when talking about youth of today versus yesterday or what have you, and in this case vis-a-vis mental health, I think we need to have an accurate picture. So um, the 1950s are kind of romanticized as the Ward and Cleaver era of kind of the family unit and childhood and youth. And admittedly, I'm using kind of that image as a straw man to an extent to illustrate my point, but I think it would be very misleading to point to that era as sort of a perfect or idealized or significantly better even era to be a child in terms of challenges. And there are some aspects that were clearly much worse at the time. BIPOC youth were often marginalized and targeted, and obviously in the US and to a certain extent in Canada, schools were segregated until the mid 50s and then integrated with significant resistance in some cases. Sexually diverse or LGBTQ plus youth were had very little avenue to kind of engage in their identities in a healthy way. And prior to the Civil Rights Act and prior to Brown versus Board of Education in the U.S., there was no legal provisions to protect any of those populations. And it goes without saying that that would have impacted the mental health of youth in those populations. Um, Additionally, there was significantly less formal recourse for youth facing significant physical or sexual abuse in homes or in their communities. And a lot of times there was a tendency to have those issues dealt with in house in a way that did not prevent them from happening in the future and promoted atmospheres of secrecy and shame, which are antithetical to someone with those experiences healing. And additionally, children with special needs at those times were often dealt with in like a punitive fashion. There was less understanding of special needs, and there were less diagnostic tools or understandings of potential diagnosis a child may have. And therefore, that punitive lens often led to people being institutionalized or put in an asylum, which is not good for one's mental health. And I don't want to minimize the fact there are significant challenges for youth today relative to then, but I want us to avoid a kind of a binarial narrative where it was good then and it's bad now, because I think that's highly inaccurate. And um, furthermore, mental health for youth and for adults in this 1950s environment I'm speaking of was often treated with significant stigma. There was limited specialized care, and there was a huge reliance, as previously mentioned, on institutions and institutionalization. Um, Now, modern psychotherapy was kind of born in the 1950s, and there is also uh, there was also kind of this, well, You might want to edit this. I stumbled here. Oftentimes, children with mental health issues, however, were treated as troubled or behavioral and faced harsh punitive treatments that were antithetical to an understanding of the root cause. Now, as previously stated, mental health was surrounded by a lot of ignorance and fear and a belief that conditions were incurable. And for a lot of children who are with diagnoses, they could live at home or live in asylums. In the 1950s, however, antipsychotics, antidepressants, therapeutic care, and and other methods, such as which are now considered outdated, like electroshock therapy, outdated in most circumstances, but not all, were introduced. So there was a narrative of curability for a lot of mental health challenges that youth may face that didn't exist prior. Um, and then there was a psychological society known as the Young Turks that in psychiatry that challenged traditional methods. And there was also a shift towards community care as opposed to institutionalization. Um, so one of the things that comes out is normal children in the 1950s reported lower levels of anxiety than in modern times. However, children who are specifically treated in psychiatric settings reported levels of anxiety that are actually more analogous to modern times. And it becomes a question of if whether or not the we had a more accurate description of the anxiety that the youth faced at that time, or that it's kind of a romanticized notion of the general normal levels of anxiety. Now, the problems that existed for youth in the 1950s are far less visible. Racism, segregation, homophobia, child abuse, and institutionalization of mental difference as opposed to treatment, and untreated mental diagnosis that very rarely could have been treated, but rather were individualized and put and addressed with institutions. So the state of mental health in 1950 was far from ideal. Now, today, the main influences that impact children are their community, their family, whatever community organizations, be it a church or community center or an activity, and social media and wider mainstream media. Those were not significant factors at that time. And some of the challenges that are inherent in that are cyberbullying is a thing now and quite detrimental. And there's 24/7 access to information, which can be either good or bad. And there is more information available about strife in the world, which frankly is not a negative thing at all. It puts people in more of a position to do something about it. However, it also can be a very distressing piece, especially for youth without limits. There's also 24/7 access to misinformation. It's very easy to find information that confirms a false narrative about groups of people, about facets of society, about parts of the world, which is very harmful. And sometimes youth can internalize those messages or act out based upon those messages. There is continuing exposure to global crisis, which was not as ready or available or as graphic in the 50s. And then something that is quite challenging is algorithmic identity formation. In other words, when people engage with social media, there's an algorithm based upon previous inputs and demographic information that influences what people are exposed to. And that leads people to intellectual echo chambers and very narrow senses of self. And for youth, one of the most natural things for a teenager to do is to explore their identity independent of their parents. And when these identities are algorithm driven, which the end point of which is to essentially buy a product or a series of products, when they're algorithm driven, people are not truly exploring their identities and instead are seemingly putting on masks, which is not in and of itself healthy. It's not a natural sense of identity exploration, which teenagers often do. So as I stated, the influences of the 50s are still there with the pros and cons associated with them. But we add basically the entire information of the internet, the entire set of information in the world, and that can lead itself in any direction. That can lead itself in identities that may be destructive, that can lead itself to narratives built upon misinformation, and that can be inherently harmful. And I mean, the presence of cyberbullying is certainly there, and there are many instances of cyberbullying that have led to negative mental health outcomes for youth. Um, so today's youth feature a historically unprecedented access to knowledge and information and opportunity, but also are all the more likely to be forced to compare themselves to unattainable standards, to be influenced by messaging that is based on narratives of outrage and rage baiting, to be subject to social pressure. Those are all facets that are exponentially louder than they were historically. And I mean, some of the things I've seen in my professional life is that there is more of a reaction to global events and relatively localized significant events than there was historically in terms of um, presentation of clients and the challenges they're facing. During COVID, there was a during the COVID lockdowns, there was a huge increase in general anxiety presentations of all populations, including youth, that I think was greatly influenced by the amount of information that was diametrically opposed and leading to conflict. Um, and I simply don't think that would have happened had there been less information or less access to constant debate and information and misinformation. And I think that we have youth with identities that are very much tied to that information that wouldn't have been formed previously. So, I mean, in a total sense, I think there are some facets of youth mental health that have improved significantly since the 1950s because we're far less likely to individualize problems. We're far less likely to see a child as a bad kid acting out and more likely to frame things in terms of what are that child's needs and how can we meet them in the context of their behavior and the resources we have. However, the stakes related to the amount of information and misinformation that's available, the stakes to access to both good and bad messaging, the stakes to access to kind of trying on a mask of identity that is not built on any sort of organic or tangible connection to the world around them, those are much, much higher. So some of the information available, like more and more kids are diagnosed with anxiety or ADHD, is born of the fact that those diagnoses simply didn't exist. And it wasn't that constitutionally more kids have ADHD or autism or anxiety, but rather there weren't the appropriate tools to pinpoint that and respond in an appropriate and helpful way. But also, certainly no one was cyberbullied in the 1950s. So any new technology, any new movement in the amount of information you have is going to have pros and cons. And the influences have both negative and positive impacts on children today. So the main difference is children have to negotiate a whole heck of a lot more information. And a solution is communication with kids and guidance in response to that information. So yeah, that's kind of my quasi rant on youth of today.
Thank you so much, Ernest, for this fruitful presentation. And this is a very important and a bit of a complicated topic that maybe
Yes,
required more in-depth analyzing in future sessions, hopefully.
thank you for having me. I love
Of,
talking about these facets of society that we have to address.
of course, my friend. And for everyone, thank you so much for joining us tonight. Stay well, stay safe, and thank you for joining Rights and Responsibilities Awareness Initiative.